Thank you, Dr. Mervett, for the overview and introduction. We can all agree cancer is typically experienced as a major life crisis with profound impacts on many areas of one's quality of life. And we know quality of life is defined by who as an individual's perception of their position in life in the context of the culture and value systems in which they live and in relation to their goals, expectations, standards, and concerns. Cancer may impact all of these areas of life, and there have been many tools designed to address quality of life in cancer care, and it's been widely studied over the years during treatment and beyond cancer care. But this literature is easy to access. So my focus today is more on the practical aspects of improving quality of life and navigating the emotional side effects of cancer care. And I want to acknowledge the roles and perspectives we bring here today as a patient, a health professional, an advocate, or cancer care service, as we work together to improve the clinical aspects of the care journey. There's many opportunities for improving the lived experience of those affected by cancer. We know cancer has a ripple effect on so many domains of quality of life and well-being. It can touch relationships, work, finances, identity, fertility, intimacy, life choices, and future plans. And each individual's responses will be unique and variable over time. And even for those with favourable outcomes, a significant majority will experience ongoing islands of disruption to their quality of life. For example, in regard to fatigue or pain or fear of disease recurrence. We do know that optimal quality of life, however, is facilitated by individualised medical and psychosocial care, and it's endorsed by our cancer care guidelines, by consumer advocacy groups. However, unfortunately, high levels of unmet care needs persist. This is across different populations that have been identified across international research studies. There's many tools that assess these needs, such as the simple distress thermometer pictured, or unmet needs measures, such as the one developed by myself and my colleagues a number of years ago, which has now been translated in many languages, with the need for information and emotional support consistently rated highly. And specific concerns such as fear of disease recurrence has identified, and this has led to the helpful development of more targeted evidence-based interventions to assist with quality of life. We have found, however, that high levels of distress persist in patients as well as in carers and loved ones, and unfortunately they're not identified or treated. We have good tools and good treatments, but there's many barriers that persist. And a few simple things I would like to suggest today that we can all do to work together to improve quality of life. There are barriers from the patient's point of view in saying how they are travelling and what may help. There may be nothing that they may believe nothing can be done, or there's no services available. They may be concerned about what their care team will think, whether they'll be seen as ungrateful, or they may even lack the practical opportunities for having a voice. This is especially so for carers that may visit at different times to the doctor. And of course, there may be a range of complex personal, cultural and background factors of which we may never be aware that inhibit the ability to identify and express needs. For the healthcare professional or service, we may lack the training, the confidence or the skill. We may be trying to achieve a lot with very limited resources, with limited time. We may fear upsetting the patient or not being able to relieve all suffering. And there may be a lack of supportive care services for a number of reasons: cost, distance, or other barriers. So what can we do? Well, communicate, work together. And this summit brings us all together to do this. As the patient, the care, or the loved ones, please use your voice. Tell your team and tell them again. This is doing something. You can educate your health professionals. You can ask for help. And this may be something that can be helpful for giving you a sense of control, as well as helping with the care for future patients. Connect with others. Team up with others. Work on advocacy. Use technology to improve care and new ways of connecting. and think broadly about what might help for you. Who can be part of your team? There may be specialist nurses, cancer care coordinators, social workers, psychologists, support organisations, a whole range of different people that may be able to assist with your quality of life. As a health professional, we need to really listen and listen hard. If a patient tells us about their pain, well, it keeps me awake at night. And where's it going to show next? We have lots of cues here. Pain's an issue. Disturbed sleep's an issue. Is it causing daytime fatigue? Certainly it's causing worry, fear, and anxiety. All important information to work on improving someone's quality of life. So number one, gather information. Number two, assess the concerns. Ask more questions. How does it affect the person's quality of life? What have they tried? And three, what would they like to try? What's their main concern? Help with arranging care and follow up on the outcome. This will educate us as health professionals about what can be helpful, but it also gives us vital information over the care continuum. We need to connect with services, build relationships, and repeat this process. So please, can I encourage all health professionals to commit to asking and practice asking all their patients how they were going. It can be a very rewarding aspect of our work. It can also be quite humbling and exhausting. And we also need to look after our own quality of life to be effective. So we need to think about various aspects of the situation that we can look at changing, but also the systems, other supports for ourselves. And maybe I could encourage you to think about 3 things you can do to take care of yourself each day. Keep it simple. And whatever your reason for coming today, think about how we can all work together to play our part and sow the seeds for improving the clinical aspects of each patient's quality of life. Thank you. And now I'd like to hand over to our next speaker, Dr. Gabriella Prevetoni.